Hello, everyone. We are delighted to host the webinar for you alongside with Dr. Pasnišin. My name is Eliška Male, and I am here on behalf of Compex to share with you our technological advancements and news. In this first presentation, I will cover our improvements and changes regarding business matters. And followingly, Dr. Pasnišin will take over to present our medical advancements and explain further new treated indications. Our presentations will be followed by a questions and answers session. We are also recording and we'll share the recording with you in the next few days. Okay. So to begin, the biggest change that we would like to share with you is that we have improved both the Jett Plasma Medical 2 and Jett Plasma for HER2 devices. They are now stronger and therefore enable better results and faster treatment times. And in my presentation, I will firstly talk about the overall improvements and then focus on improvements in the gynecology field and aesthetics field. For the overall improvements, the new improved versions of our devices won't need calibrating anymore. Previously, the devices had to be calibrated prior to use, as seen in the picture on the left here in the slide. And the new improved versions are now able to calibrate themselves automatically, and therefore no manual calibration will be needed by users. This will not only save time for the doctors, but also provide a more pleasant experience using the JETT devices. Additionally, as a lot of you know, previously a red light lit up on the plasma pen when there wasn't any current going through to the patient, and it switched to a green light once current started going through. And this has been replaced now by an orange light. So instead of the red light previously, no light will be lit on the pen before contact. And then when the plasma pen tip is at 2 millimeters or less from the patient's skin, current starts going through, and therefore at the same time the orange light will show. This is mostly to prevent possible interventions with the device and operational errors. You can see the orange light there on the second picture. And then alongside the new LED light and the automatic calibration, we have also introduced bigger electrodes that, thanks to their larger surface, prevent any possible burns that might occur due to the higher current in the improved new versions of the devices. And they are also more comfortable for the patients to hold. Later on, Dr. Pasnišin will show you the device as he has it there with him. Okay, moving on. As for the improvements for gynecology, as I already mentioned before, the improved version of the device is stronger with an increased current, which enables a shorter treatment time and better results for gynecology. And additionally, we have added new optional applicators, which are the ones that you can see here on the slide. And they were previously offered with the Jett Plasma Medical 2 device for ophthalmology and dermatology, and now they are offered for the HER2 device in gynecology as well. And these isolated and golden applicators enable a new treated indication, which Dr. Pasnišin will explain a bit later. Okay. Here in this slide, you can see the optional accessories which we have added with the Jett Plasma for Her device. So you can see the 3 new C waves, the isolated applicators, golden applicators, and also the cylinder electrode, which is an optional accessory that can be purchased alongside the Jett Plasma for Her device. Okay. Moving on to the improvements with the Jett Plasma Medical in aesthetic medicine. So we are happy to introduce that we are currently finalizing clinical studies with new optional applicators that will soon be available to be purchased with the improved versions of our device, the stronger versions. These are cannulas that will come in multiple sizes and also will come with a new plasma pen, which will allow for these cannula applicators to be more stable as they work on a screw-on mechanism. The cannulas will be used only in the new cannula mode, which is provided in the Jett Plasma Medical 2 improved version. And there is new indication for double chin reduction correction, which is an indication that Dr. Pasnišin will explain further as he has experience with using or trying this indication. Yeah, and in case of interest, a training by Dr. Pasnišin on this indication can be arranged both online and in person. If you have questions on this, we can discuss that later in the Q&A session. And we would also like to share with you that apart from these improved versions of our devices, we have also accomplished FDA approval. After years of my colleagues' efforts, we have successfully received this approval under the name of JETT Medical Device 2, and this is for non-ablative treatment of wrinkles and rhytids, thanks to which now both golden and silver applicators are now FDA approved in the United States. And lastly, I would like to share with you information about possible ways of purchasing the new improved devices, in case you are interested. So these devices are approved under the MDR certification, which is a regulatory system for the whole European Union. Therefore, if you live in one of the member states of the EU, you should contact your representative distributor, which should assist you regarding availability and prices in your region. On the other hand, if you live elsewhere, registration is required in your country in order for you to be able to purchase the device. Okay, so this concludes now my presentation, and I would like to invite Dr. Pasnišin to continue. I believe he will first show you the device and then continue with a presentation regarding the indications.
Hello, everybody. I'm Dr. Pasnišin from Platinum Clinic. Now I will speak about new future of our device called Jett Plasma for hair. I can show you on this. I will show you the next one, how it's working, how it's what is new in our new machine. So I want to one thing apologize my voice because I'm a little bit not healthy, but I think that will be okay, and I will not lost the voice during the webinar. Okay, so I want to introduce our new better, faster, and more powerful machine. Now you have two possibilities. One is gynecologist part, and one is working with the gold applicators. So what Eliška told you, that is very easy to working with this machine, because you don't need making calibration like before. It was for doctors and using a little bit one part of the machine what we don't like. Now the company said that is very good, because you don't need to calibration, just switch on the machine and it's working. So it's very easy to working on this machine, and I think that will be for you good to testing and using this machine. So we have new applicators called Wave C13. You can see on this monitor, you can see 3 heads. I will speak about this later. And we have, of course, 2 heads what we had before. So okay, wait. This applicator is for vaginal rejuvenation. and this is for to treat incontinence. We know that we can treat incontinence when it's stress or urgent. It works, this machine, to both part of incontinence. So it's very good in one session, and 3 parts to repeat. You treat all incontinence, the stress or urgent. So it's very, very good for patient. Now, how Eliška speak about working on double chin. We use new applicator and with new cannula when we used for reduce all this part of double chin, and making 2 things. One thing is the fat is getting out. This is disappear, and the second part, what is the second part of this treatment is that is when you use this cannula inside, there increased collagen in the double chin, and it's getting smaller, and the part of skin is getting up. So it's very easy to use, very friendly. Just 5 minutes to using these things, and after I will show you how it's work on the photo before and after. So it's very, very good. So I think that Eliška can switch on the web presentation. And after we will have, if you have some question, we will talk. We can talk about all the parts of the machine and what you want. So this is our now updates. So how I told you that we have in one machine, we have two things. What now the machine, what we will do with this machine, what we can do with this machine. So we can use on gynecologist part. So it's very good, and it's you if you know about now our device, you know how it's working, how we working with this machine. And now is the second part is aesthetic medicine. So on aesthetic medicine, we using to correct labia minora, labia majora with the flat probe, and now it's we can making parts with the golden applicators. So we can using now on condylomats. So it's very helpful for doctor or gynecologist when we do when making treatment. You can see there is something problems, so you can treat with one machine. Of course, you can use this golden head. You can use for fibroma, hemangioma, different part of spots. You can use for small veins around the vagina. So, but so it's very easy to treat this part, but you can use on different part of the body. So it's very easy for dermatologists too and gynecologists too, like me, because I'm aesthetic doctor and gynecologist too. So I use this machine to both part of my work, and I using now every day. So it's very, very good. So Eliška, next. So now we have 3 types of new G applicator waves. Now we're using for treating, this is very new stuff, we're using for treatment and rejuvenating the cervix. Now we can use these 3 types probe to treat many stuffs like cervicitis, some inflammation around the cervix, what is inflammation inside the cervix. We can use on atropium, and now we search that we can use for HPV virus. And now we starting on study on it, and we know that on 90% HPV virus is disappear. So now we're testing, and I I think that in future will be one part of treatment of HPV on the old world. So I hope so. So you can use different types, and the heads it look like corners using to directly put inside the cervix. And the third, when you can use for a rounding parts of the cervix. So very easy and very nice. So Eliška, next. Now we can a little bit talking about the reduction of double chin. You can see on the end of the picture, you can see the new cannulas. We have three different type of cannulas. It depends how it's big the double chin. So we can have 60, 80 to 100 millimeters cannulas. It's sterilization. We can use sterilization this cannula. So you can use this cannula on many patients, and it's very safe. And in the future, we will have seminars, webinars, how to do it, how exactly do it, the time how to do it, to reduce all the part with this treatment. It's very many invasive treatment. On my machine, I using only 5 minutes and one session, and the fat is reduce of the fat is about 90% of all the part of the chin. So I think some women that they have very big double chin, you can use second time and third time. But in my treatment and my practice, I have many patients that you can use only one time, and women are very satisfied. Now we have the certification, and we can use to all world to working with this cannula. So thank you. Next. Now you can see the picture of the woman, how it looked like before and after the rejuvenation of double chin. On the first photo, you can see that she have double chin in normal visualization, and after this part, the second photo is 3 months after double chin treatment. You can use next. This is the same woman on the picture, and you can see that it's reduced about 90%, and it look like she never have double chin. Yeah, so it's very nice, easy and nice result of this treatment. What is only 5 minutes, 5 minutes to make it, and you can see perfect result. Please next. Now you can see the woman and man. It's exactly, it's working on the man too. It's not just a gynecologist machine. You can see that we use on the man, and you can see how to reduce the double chin on the man on the third and fourth picture. And upper part is the woman, how it look like on the old part of the neck. When you use the double chin, it's reduced, and you reduce the skin on the whole neck. You can see it's perfect. So I hope that when we use this treating on many patients. We have so many satisfied and nice women around us. Of course, the men too. So now it will be the part of the questions or what you want to know about the device, because this device, the device, normal device, I using about 4 years now. So I have many experience how it's work, how it's working on the woman, what is how it's work this device, how it's have the problems with the woman if that have after rejuvenation. But on my all part of 4 years, have only one woman have a little bit said to me that it's not working, because on the start it's working perfectly, and after she had the big car accident, it's stopped working, and we want to try to rejuvenate once again, but it's not working because it was something problem with small pelvic problem. So I think that real problem with this woman, that some damage inside the muscles, and it's not working. But 99% of my patients are very satisfied with this device, and said to all women that it's working, and it's when it's come to me in the next patient. So it's very good. So now it's part when you can talk about this device and we can speak. You ask how it's processing of sterilization of the probes. So these our probes are certificate for 10 sterilization process. So you can use fluid sterilization or autoclave sterilization for using for the when you can use the plastic things. So
I would like to ask, of course, about the chin, because when you apply this device, just up the surface,
yes.
you might affect the very, very superficial muscles. Also, I'm using this Botox for vaginismus. I'm just not sure, but maybe this might affect that Botox also.
So you know, I using this if the woman go first to Botox and after our rejuvenation of the vagina, is no problem. It's working, same effects, and if you using the Botox before and after, it's no problem.
Okay, this doesn't make any dissolvement for the Botox. What about the fillings?
Feelings is the same. When you use for example, if you use the feelings before,
Yeah.
and you make a rejuvenation inside the vagina, it will be more narrow inside, but for example, acid hyaluronic will not disappear, so will be more tight.
Okay. And also, will it affect the effectiveness of the PRP treatment or mesotherapies?
It's no problem. I using always on the face. I using and
Altogether?
mesotherapy. Yeah, altogether it's no
No
problem. But
interval.
only, but I use, but before between the treatment is 1 month minimum.
1 month.
Yeah,
Okay.
it's better because when you make a rejuvenation of the vagina, you make free session after 14 days to 3 weeks between, and after they finished the third rejuvenation, we wait for effect to maximum effect 3 months. So I always said women that before the time they done something application inside or mesotherapy or something to wait. It's just wait, yeah, for the treat to after they finish the treat, because the collagen when you stimulate, it's finished to increase after 3 months.
3
So
months. Okay.
yeah. So you can making mesotherapy, for example, on the vulva. You can use, it's no problem. Yeah, and rejuvenate inside the vagina, so it's no problem to making this. Yeah, so nice. But I think that if women want to making narrow vagina, more narrow, after you using our jet plasma for her too, she will don't need the aesthetic inside fillers inside.
Okay.
Because will be good.
Okay. May I ask another question?
Yes.
Yeah. How long do you use the procedure for urinary incontinence? How long does it take? The duration of the session.
Now, when all machine, I using 20 plus 20 minutes in one session. It's about 40 minutes. Now we starting with our new device that is increased 100% of energy. So now we working on the new protocols to be shorter the time. So we think that it will be maybe 10 plus 10 minutes. So it's 20 minutes to one session, but we are now working on our patient to be satisfied. So now we're working on the new protocols, but on the old machine, we're using 20 minutes with the this probe and 20 minutes with this probe, the wave probe. So before we using only just a wave probe, 15 minutes, 20 minutes, and it's not so enough because the effect was good, but when we use both on one session, so to rejuvenation and making with the working on incontinence, the effect will more increased than you use only this probe. So now we're working on the old machine 20 to 20 minutes to maximum effect, and the women are very satisfied.
Okay, thank you so much.
You're welcome. When using rejuvenation, just rejuvenation, I think that when you use just rejuvenation, you use this probe only 20 minutes. Yes, so in free session.
Hi, this is Jim speaking here. When is the cervix protocols will be released with respect to age groups, risk groups, and applications and conflicts or contractions, etc. When they are going to be available?
And now I'm working on it. It will be soon, very soon.
Any estimated time date our salespeople are really enthusiastic about?
It will be very soon, because now I have experience from our doctors, and now we taking all data and to compare what is the best time for using, how much time you're using for the cervix, and I think in maybe in 1 week I will have working and finish the protocols, and after I give to engineer Neshpor to check, and after when we can release. It's only maybe 3 weeks maybe.
Technical question. What is the maximum power right now? 10 watts in total?
Now it's better to speak engineer Neshpor, because he knows all technical data on the new machine, because I know only the old one. So
I have an answer. So the watts didn't increase; they're the same. What increased are the milliamperes. They used to be 2, and they increased by 100% to 4 milliamperes.
Your electrical current is increased only.
Yes, the current.
Okay, thank you very much. Thank you.
You're welcome.
By the way, this electrical current in ampere, don't you think it would higher the potential risk for health, especially the cardiac health problem patients? I mean, maybe a battery, using battery or a heart implements or something. Is there any clinical research result about that?
Well,
My máme klinické data, pro 4 mA je to ještě bezpečný.
So we have clinical data that for 4 milliamperes it is still safe, but with regards to your question with the cardiac patients, when they have cardiac problems, they shouldn't use the device ever, like not even the less powerful version. It's like it's a contraindication for our device. So
okay, I got that. Thank you
Yes,
very much.
I have many patients that have a problem with the heart. Yeah, so arrhythmia, some problems with heart rate, and they are safe. I use many treatment on it. Yeah, and they are very healthy.
Okay, that's great. Okay.
Yeah.
Thank
Only
you
just
for
only just be careful on neurosacral stimulator. What is on the back or belly, or a peacemaker. So it's a contra indicator for this. Yeah. So always ask if you have some medical devices inside the body. What is electric? So you can use this our machine. So
yeah, and all of this should be explained in the manuals that come with the devices, and also in the protocols where all the contraindications. So hopefully that should give you answers on all the contraindications as well. Or also, Mr. Neshbor said that you can write to him and ask him, Mr. Tsem. You can.
okay. Thank you very much. Thank
Thank
you.
you.
I'll get in touch with Radek. Thank you.
yeah, you're welcome. In exosomes, yeah, it's now in Czech Republic the new treatment, and I have maybe 3 patients that have exosomes to use on vagina, and now it's on the progress. So I don't exactly how it work after. So I don't have no experience, because now in Czech Republic it's a really new thing, and not so many patients have to know about this, and no many patients don't use. Yeah, because exosomes I have in my clinic about 4 months now yet. So I don't use the both. So I have no experience, and the different patients that they come to, they are from different clinic. They use exosomes on vagina, so or vulva. So now I treat incontinence. So I don't know how it's working. After I have maybe 3 months, I will have some experience about this.
For example, Dr. Alan Sod is using exosomes, so which is a doctor in the United States. So maybe with the recording later, we can send you some information from him.
And it's not a question, but a request from your side. It's a very common question, and it's not clear for the end users, for the gynecologists, and including ophthalmologists. Every single prop has different sterilization method.
Yes.
And intravaginal cervix, vulva, non-contact ablative or contact non-ablative. Can you please, this is not a question, a request to your side. Can you please send a detailed sterilization method after certain applications? The sterilization methods should also diverse, because if non-ablative application applied on patient, the method should be different, and the time is very important for the end users, patient by patient, and the infection should be out of consideration. Please the data and the papers are not adequate about the sterilization methods.
Yeah, we can write for you. Yeah, because it's you yeah how you you said that all type of the probes are different sterilization.
Okay, thank you.
Yeah, you are welcome. It's no problem to write it. Super. You ask about the sclerosis lichen. It's working, and you can use this small probe on it. It's we call it flat probe, and it's working. But on this treatment, it's depend how it's big, and when I treat this patient, it's depend about 3 to 10 session to cure. Yeah, it's if lichen sclerosis is only on the one part, small dots or starting, it's need about three session to cure, without the corticoids. When we make rejuvenation, we're using normal ultrasonic gel. We don't use cream.
This is Francois. Lucas, as you know, we are working on
Yes.
both techniques, you know,
Yes.
ophthalmic, derma, and also gynecology.
Yes.
This is very interesting experience because recently Dr. Rosario Gulias from Mexico make
Yes.
an incredible treatment. You know, when she was confronted with a long process of inflammatory reaction on one patient during 6 months. Finally, she was using the normal treatment in order to treat this patient. At the end, she used a combined treatment using these normal molecules for treating his inflammatory situation, and she used simultaneously application of electroporation with a jet. And the results are impressive. You know, the sclera turned for irritated situation with some drastic problems with the cornea to a white situation, and this is the amazing cases. I don't know if in gynecology or for aesthetic application in gynecology, you find some ways using this combination of drugs or creams of normal treatment we can use on the skin with the addition of electroporation.
Yeah, you know, it's very nice to hear that it's working with the cream, and it's to cure the inflammation. So what I try on my practice, I try to use not use normal ultrasonic gel. I just use the acid hyaluronic, normal acid hyaluronic to put inside, like when we use in the gel, and for curing after operation and so on. And I using on women, they are very narrow, and they are very dry. And after one session, they are very satisfied. It's the wet is disappear. They can work normal walking after that. So I use acid hyaluronic inside the rejuvenation just only for very old patient, and it's very good results.
Okay, thank you.
You're welcome.
May I ask another question?
Yes.
Do you have any experience using this device with female arousal disorders? Since the clitoris is very, very superficial, does it any good effect on the clitoris and orgasmic feelings or
Yes. When I using the rejuvenation of labia minora and majora, I one of part of the treat, it's rejuvenate the part of clitoris, the hood of the clitoris, So it's working very good because it's getting smaller. It's like the clitoris is getting out, and women are very satisfied, more sensitive after during the sex, and they are told me that it's something different in their sexual life, because older women and women that have the problem that it's clitoris getting directly covered. It helps because it's uncovered when after the rejuvenation. So you can use and try it without no problem.
What about the intensity?
Intensity on old machine, I used 8.
But it's told to me
Mhm.
I should use just 5 for the skin, for the vulva.
Yeah, you when on the new machine you use 5, yeah, but you have the old one,
No, the new one.
the new one. Okay, if you have new one, it's 5 because it's 5 on 8 on old machine.
And it's okay for the clitoris, right? Because I
Yeah,
tried
it's
once and
yeah.
the patient was very, very disturbed. She didn't like the feeling.
Yeah, be careful because you must use on it so much gel. Yeah, and you using what probe do you use on the clitoris?
The flat one for the
That
vulva.
one. Okay, perfect. And when I do it, I use so many gel because it's very sensitive on electric, little bit small electric shock, and you must be directly on this clitoris, on the caput of the clitoris, and you be careful to not put the flat a little bit out because it's very painful for the woman. So put so many gel on it and working very slowly, but not stop. Yeah, just always rounding, not stop.
Okay, thank you.
Yeah, it's working very good.
Thanks.
We are satisfied.
Just a question concerning dyspareunia. We saw in an article made by the FDA the fact that the radiofrequency can affect the sensibility of tissues. And with the JETT, we think we don't have this this effect. And do you have some specific protocol to treat dyspareunia with the JETT?
Not special protocols. I use directly like normal treatment of rejuvenation, 20 minutes. Yeah, directly. And if she it depends on the woman, because sometimes when I start working on it, they are very tight, they are very in tenses because it's painful, but I getting very slowly, very gently, and after sometimes I using the wave probe because the big one is very painful for them. Yeah, so I use the wave inside, and slowly all the part I going directly around, and it can help. But some women, they are combinate. They have pain inside, and they have directly inflammation inside the vagina. So I before I making treat, I cure them. Yeah, and after cure, if she has okay, everything okay, about 3 weeks I start rejuvenate.
Okay. And in your experience, when you treat some person who have this painful very high at the beginning of the first visit, and if you make a treatment, I suppose you make several treatment 1 week or 10 days later in order to accomplish the complete treatment. do you see some improvement from the first session to the second session, for example, and from the second to the third session in your experience?
Yeah, I have experience because sometimes I don't because they are very painful inside. So sometimes we start only just beginning. We start 5 minutes just treatment introitus, just the tissue around, and after we go the next session. We try with the wave probe, getting no, this probe, wave probe. We're using getting deeper. Yeah, and after that they found that it's on the second session it's working to 20 minutes normally.
Okay.
Yeah, so
Okay.
it's I don't know if it's really helps that you do only just introitus. Yeah, for 20 minutes, 5 minutes. It's depend that they sometimes they have different part that it's very painful. Sometimes it's after the birth, very scar of the episiotomy. It's very painful. So I directly go to scar. Yeah, for 7-10 minutes, waiting for 2 to 10 days, and you can do next session, and it can help when you go inside.
Okay. Also, another question concerning the fact that if you are confronted with a patient who are situation with a lot of painful situation, do you have experience using some gel like the gel we use in urology with anesthetic incorporated in gel?
You can use if you want, you can use gel with anesthetic. Yeah, we have the new one, special gel for hysteroscopy. I don't know if it's in France now. I think that is it's quite new. We using the same gel. It's in like injection. We putting in cervix before the hysteroscopy, and it's working the same, because some women are very painful. So you put this gel inside the vagina, waiting 5 minutes, and you can do everything what you want inside the vagina.
Oh, perfect. Lucas, could you split with Aliska this name of this gel later in order
Yes,
to inform everybody?
I
Don't
will.
worry.
We have in the hospital, but I will write you what is the name.
You can put this picture of the product with the
Yeah,
component
I can.
in
the chat of
Yeah,
Jett,
WhatsApp.
and
Yeah,
that's
WhatsApp
that
chat.
yeah
Yeah,
WhatsApp group, and
yeah.
I will be sure in that case that
Recording in
everybody
progress.
Yes, I will.
perfect.
I will
That's
write,
good.
and
That's
do
good.
not forget.
Also, Lucas, you show 2 years ago incredible picture of a treatment on vulva with a rejuvenation and also
Yes.
treating an inflammation. If you remember, these three
Yes.
pictures was very, very strong. And
Yeah.
do you have the other kind of picture that's it's very helpful to show what we can do with the Jett, because the people cannot imagine the level of power of the equipment. But when they saw this picture, they're convinced about the fact that we can do a lot of things. You know, if you have other picture, it will be helpful to add this picture also in the Jett for our group in WhatsApp.
Yeah, it's possible to send. You want directly this picture on or different picture?
Yeah, we have this picture, and we have split the picture in the
different,
group. You know,
different. The next one.
unfortunately for the new people who
Yeah,
arrive
yeah,
late,
no problem.
they don't see the story.
Yeah, I have some that I can show. Yeah, but
Yeah.
many women are not me allowed to send. It's pity because I have a little bit younger girl, and because they are very satisfied with reduction of the vagina and the labia minora, but it's pity. Many times I want to, please, can I share this picture? It's not possible because they
Okay.
think that what we do with the photos. I said that it's not just the vagina, not the face. So,
Yeah.
but on this girl are very nice, like on the first picture. What I do on my first patient.
The fact that you have to tell that during this communication is very important because you know, we can understand perfectly the fact that the woman are not agree to split this kind of intimate images. But as you are a specialist of this kind of treatment with the JETT, and probably one of the first since a long time, it's also important for the people who see this exchange from today, later, to know the fact that you have a lot of cases accomplished with the JETT for this kind of treatment.
Yes.
Thank you.
Yeah,
Thank
you're
you.
welcome. Yeah, no problem. I will. I write. Do not forget. I'm getting older. So somebody try to use double chin procedure. I think that not. Yeah, not yet.
For us, it's too early because we didn't receive the new equipment. We expect to have
Yeah,
it as
yeah,
soon as
yeah.
possible. But we are very excited about this this new feature of the product because
Yeah,
we have a lot of
yeah,
requests concerning this aspect,
yeah.
and we hope to have it
It's
soon.
it's like miracle because use only just 5 minutes treatment, not painful, and effect after 3 months. It's very nice, and the women are after 14 days they feel that it's very changing. So it's like miracle because before I using some mesotherapies and some mesotreats and so on, and it's very easy. One dot you make with the one hole you do make with one needle and rotating, and it's very easy to remove the fat, and it's very nice. So I hope that you will love it.
And did you make anesthesia for this application?
Yeah, just it's very funny because I use just a little bit when you put the spots, small spots, when you do the hole, I using the anesthetic, and
Yeah.
it's getting directly around it a little bit, and you put inside, and on the part when you do it, they feel nothing. They feel something more like energy on the end of the parts of the needle. When you, for example, when you do with the probe, like part of the like this here, and you go with the probe, they feel a little bit something like electricity with the battery. Yeah, but they are saying,
Yeah.
oh, it's nothing. But here,
Yeah.
when you rotating, do nothing. They feel nothing.
Okay.
What kind of, sorry for interruption. What kind of anesthetics? Topical gel anesthetics or
No. I using injection. I use injection,
Okay.
lidocaine, mesocaine.
Mesocaine type.
Yeah, I using
Okay.
the diabetic needle, the small one. Put one dot, and after put small the pink needle, the big one, and after put inside the cannula.
That's
Okay.
mean you just put a little spot of anesthesia in order to in the entrance of the needle, and
Yeah.
after that you don't use in the whole place the anesthesia. Okay,
Yes.
that's clear. That's clear.
Yeah, it's
Okay.
perfect. You can use EMLA directly on all the parts, yeah. But I don't using because for example, you must 20-30 minutes have the patient, they come, and you do 40 minutes on the waiting for 40 minutes, and you do 5 minutes procedure, so it's not rentable. So I put the small parts, 5 minutes, and it's work. It finish the work. Put the tape on it on the small hole, and next day getting out, and it's working.
Did you write a protocol to go on that way to perform this treatment?
Yeah, I am now I speak with the engineer Spor, and
Yeah.
I will writing the protocol about this
That's good. That's
because
good.
it's the new one, and I want to make on the protocols the photo where directly you is the best way to put cannula inside.
Yeah.
And make to be safe, yeah, because it's near are the nerves are they're not steroids, so must be careful.
Yeah. More details and more information we have in the protocol, more comfortable are the new users.
Yeah.
And yeah, that's good. And if you can also have some film movies on the process, it would be helpful to give the protocol to the doctor and to show on the movie how it's work. You know, that's also can be a big a nice topic in our chat of Jett for her. You know.
Yes,
To
I
talk about.
I have the video from my first application.
Yeah, good.
Yeah,
Good.
but it's
Perfect.
yeah, I for my first time when I tried.
I ask every time the attendees to provide videos, pictures, comments, you know, in the chat. This is very helpful, you know.
Yeah,
Yeah.
I can do it. It's no problem to make
Thank
it.
you.
Yeah,
Thank
you're
you.
welcome. Just it's a new one now. It's starting to to selling this that part because I using this treatment. I use about 1.5 years, maybe 2 years. I using
Yeah.
so many patients of this to do it. So it's now it's like eat the bread.
Okay.
So good.
Nice.
And women are very satisfied, and sometimes they come women with the friends, please do it to this girl the same what you do to me. So it's very funny.
Good.
So for it's the best thing that it's always when you see and you do it direct with the doctor, because he watch and said, okay, wait a little bit, put inside. Yeah, it's much better than video. So I hope that we will meet in Brno or Ostrova to 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 teach you how to do it. Very easy, but must be careful to do it. If you make no cannula and not working on this part of the neck, and on using for example, the mesotreats and so on. So it's a little bit difficult for starting. But when I always using many things to this neck, so you can orientate what you can do, what you don't to do to be easy to making the procedure. So the procedure after this is only just 5 minutes.
Okay.
Yeah, and you can earn much money.
Good.
On my clinic, it's very this procedure you earn so easy money in short time. This is the
Good.
best procedure.
Thank you for your time. The two major things we are expecting, the new cervix prop application protocols, and the detailed sterilization protocols, because it's very confusing. Each application needs different kind of sterilization methods.
Yes, I have my notes, so I will do it.
Thank you. Thank
You're
you for
welcome.
your time.
You're welcome. You're welcome.
Okay.
Thank you, Lucas. Thank
You're
you very
welcome.
much. We
You're
go
welcome,
now
Anton.
to the Congress in Switzerland. You know, we are in an airport. I'm in an airport. I just leaving from my plane. I opened my phone. in order to follow this discussion. It's very, very interesting. And I think we have a lot of things to do with the JETT, which is in different specialties, showing the fact that it's so efficient. We have incredible picture of rejuvenation of tissues in other application. And I invite the ophthalmic doctors to follow activities in gynecology, and also gynecologists to follow activities of ophthalmology in order to learn about the kind of treatment we can do on the tissues. And until now, some doctors have discovered this improvement on rejuvenation, and they are saying only one word in both chat: amazing. It's amazing, and we don't find any product we can provide effect than the JETT can provide in gynecology or in ophthalmology. And you know, I tell all of our clients in gynecology, don't forget to tell your patient, because they don't know the fact that the JETT exists on other applications for ophthalmic. And I receive call now because we informed the doctor, gynecologist doctor, about the fact that we have this incredible device in our hand with doctor we can use in ophthalmology, and we say the same thing to ophthalmologists. Don't forget to tell your woman you are during the treatment, after the gynecology treatment, to set air, because sometimes, and a lot of times, not sometimes, a lot of times, they have not only problem eyes, but they have also problems in their intimate part, you know. And the doctor need to say, okay, if you have some problems in gynecology, don't forget the fact that some doctor can treat you. Same for ophthalmology. If you have problem in gynecology, some doctor can treat you. And this is very important to inform all about the JETT exists for different specialties.
It's a big thing. I always talk about this JETT plasma on all my patients. Yeah, it's good when you one woman you do treat, and they are very satisfied. It's getting to 10 next woman. They said when it's working, they come to me. So it's very nice product, and very powerful, product. And before many years, an engineer expert come to me and said, we have the new machine. I said, okay, it's next machine with rejuvenate. It's not working really. Yeah, and so now I know that it's was my mistake.
This is true. This is true.
New version physically. Do you have any plan to exhibit your new version here in United States?
New version on United States. Engineer Neshpor will tell you if he has got now new machine in USA.
So firstly, Dr. Alin Sod is attending a congress in Florida, which I believe is the 20th of March. I could be wrong. And he has the new improved version that's approved under the MDR regulation. So he will be displaying that there in later this month in Florida. And then also my colleague Jan Sladek is going to the Las Vegas The Aesthetic Show Congress at the end of June. And there he will display the new improved version of the device as well.
So I can show you how it's starting the machine, where it's very quick without the calibration. It's a miracle when we don't need now. So you can see it switch off the machine. Just switch on. You see, and now you can work.
Okay.
without calibration.
But the patient still have the rod in the hand.
Yeah.
Yeah. Okay. Okay. It just the calibration is automatic now.
Yeah. Yeah. It's very easy now.
Okay. Fine. Good news. That's avoid a lot of call.
Yeah, you know, many doctors calling all when buying this machine, the first time starting, they calling always, it not work, how to do calibration.
Yeah, it was at the beginning, you know, but
Yeah,
with the new version, Mr. Nespor
yeah,
improved a lot the equipment. The last one are very well improved, and we saw the fact that these improvements are more easy for the beginners.
yes, yes, yes. And it's very easy to remove the condylomas. It's very now I using, yeah, the spots, yeah, some fibromas around the vagina. Use the golden one, the needle. It's very easy, very quickly to remove. And what is important, because many patients go to laser to remove these things, yeah, directly the condylomas. And after the remove the lasers, you can see always they stay the white spots after, yeah. And when you do this machine, they see nothing. So you have not white spots. They're healing without the scars, healing without the black spots or white spots. It's healing directly like nothing will be before that on the vulva. So it's very easy and very nice effect after when you treat.
In our experience, Lucas, with
Yes.
JETT, with the plasma application, we saw the fact that the treatment is very superficial and it doesn't destroy tissues deeper. And compared with the laser, we can provide some fibrosis. The JETT is treating on surface, layer
Yeah.
by layer, and that's provide very nice result after
Yeah,
treatment,
yeah,
plasma
you have right.
treatment.
You have right. Yeah, it's fantastic effect. And I using on how to say wait how to say in English, warts. Yeah, I using on the warts
Yeah.
on the feet. Yeah, and you can always it's very deep, so you getting deeper and deeper, and then you stop on the normal tissue and always remove and very gently and quickly to cure. So you can use on the legs too with the warts, yeah, on the fingers and on all the body. So it's very effective.
Mhm.
And you can see on sometimes when it's not long time warts, maybe 10 years, but it's just for example few months, and you can see when you getting deeper the warts, it's just getting out alone when you burning, and you can see under this normal tissue. So it's very easy and very fast to remove. And but the patients are very satisfied because it's not so much painful after this treatment, and it's healed very easy and quickly.
We saw this effect also in angioma, this red dot in the body,
Yeah,
and the JETT is very efficient. We make a
yeah,
lot, and that's create a treatment. We do not produce any fibrosis or you know or
yeah.
scare, and
I love it to do
yeah,
hemangioma, small one.
it's very nice. It's very
Yeah,
nice.
I love it because you making very quickly all the body. You make remove the red spots, and women are very satisfied when you remove so quickly and easy. Sometimes it's just 1 second, 2 seconds to remove. I love it.
Yeah, plasma application with JETT are really very fast. When we start making some training with doctor for dryness in both specialties, no, and
Yes,
the doctors see the fact that with the first version or second version of equipment, it's took time and they need to spend time with the patient. Assistant make more and more application in order to save time for the doctors. And when the doctors start the training for the plasma application, they discover the fact that with the new improvement on the power of the second version of JETT, that can create very fast treatment. And they are so happy to see how many treatments they can perform in a short time. They love it.
Yeah, really. I love it. You know, I always I use Jett plasma. I use every day because it's one device for all.
You know, Lucas, what the doctor says when they saw many in dermatology or ophthalmology, we have a lot of application. And at the beginning, the doctor was a little bit disappointed about the fact that they are thinking of how I can use this kind of device in my practice. And what we saw in all cases, the fact that the JETT device is very addictive. When the doctor starts, they learn about how they can use very fast in some application, and they told us how I do before, because we cannot avoid now to have this device in our offices. This is
Yes.
incredible.
Yeah,
It's
yeah.
addictive product. Addictive
Really?
is a term, you know.
Yeah, it's very nice. I tried for when I started working with this. I tried to different parts of what I can do more with this Jett plasma. Yeah, so I try on many parts of the body, trying on many things that we can remove, and really I before I will must buy 3 or 4 devices. So I have one is working on all it without scars. So it's very nice to remove on the face. So now I have one way that they one woman have after piercing they have the hole, yeah, on the face. So she said to me, "Can you remove the hole?" And it's working. And I removed the hole because when you burning the parts, really small, smooth, getting a little bit deeper, and it's closed. Yeah. After when you see not hole on just a little bit small, on the star, you see the small pink part, and after 1 year it's removing. Yeah, and you can after this, if it's under the skin, you put in on the up a little bit acid hyaluronic, and it's smooth and you can see nothing. So it's you can use for it too.
Do you have some pictures about this treatment before and after?
This picture I have on the start half, not have on the end, because I want to meet her and make the photo.
Okay.
Yeah, but I have something same on the head.
Okay. Nice.
Yeah, because
Nice.
you know, she has some small dots after acne. Yeah, and she go to laser, and with the lasers make more deeper and more bigger hole.
Yeah.
She was
Yeah.
terrified that it's worse than before. So they found me, my clinic. It's possible to remove with the plasma, and we remove, and it's very nice. But the first time I was a little bit scary, because when I burning, it's under the small hole was the big hole. So I have for the first time I make very big hole, bigger than before, because the laser was destroying.
Yeah. I think now, as we know more and more better the specific plasma application of the JETT from Compex, We have more experience talking with doctor. We use other kind of plasma application with different devices. We were discussing with the team from Brno in a last meeting recently the fact that when we make plasma application, the specificity of the current of Jett is making some, burn on the surface, not deeper. But as the current is crossing the tissues just behind the treatment, like the silver applicator in contact of tissues can provide some improvement. We was thinking about if this current make during the plasma application can also improve the layer of tissues just behind this discharge on the surface. And this is a real question because for conjunctiva, for example, in the eye, some doctors are using the plasma application, and the marketing team from Brno told us they are very happy about the result of this kind of treatment, and they are using plasma application. Also, doctor, mainly all other doctors are using now direct contact with silver applicator on the conjunctiva, and they have incredible rejuvenation of tissue and improvement of tissues. And we think about perhaps the current is giving in both cases improvement. In the case of plasma application, it could be very interesting to continue working on that way, because perhaps we have a dual gain in improvement. Not only the fact that we treat the surface, but also the fact that in the same time we are treating the tissue just behind this plasma application.
Nice.
This is very interesting things.
It's very interesting. Very interesting.
Yeah. We saw the fact that we have a lot of opportunities, because we are working since a long time now with the Jett product, and we, step by step, we are discovering this kind of new improvements, and it's very exciting time, to discover all of these things, because we have not reached one limit. We are going over this limit and discovering the fact that with the combination of plasma application and electroporation, it's a very strong device.
Yeah, very strong. Super.
Thank you, Lucas. It was a real pleasure to talk with you and to saw your improvement on all things technical and clinical.
Thank you.
It's a real pleasure. Thank you to you.
Thank you.